People move to cities and towns to make their lives better.
Cities offer better schools, better jobs, and better hospitals.
But city life has a hidden side. There are dangers lurking in the cities for everyone.
These dangers are even worse when you're poor.
The theme for World Health Day 2010 is Urban Health. For the first time in human history, we have more people living in cities and towns than in rural areas. And the biggest growth would be seen in Asia and Africa. Cities and towns concentrate opportunities, concentrate services, and of course, good for employment. But on the other hand, cities also concentrate health risks and health hazards. Unplanned urbanization is a big problem in many cities. It creates problems and challenges for social services like housing, health, education. And in many of these big cities, air pollution, noise pollution, unhealthy lifestyle are at greater risk.
Everyone knows that city life can be challenging. But what can be done when money is scarce and there are so many problems? On World Health Day 2010, WHO challenges us to take 5 actions that could make a difference.
Promote good urban planning.
The first step is to plan cities with health in mind. For example, promoting physical activity, making healthy food available and affordable, providing health services for all, improving road safety.
In New York City, we've shown that you can take steps to significantly improve the health of your citizens, even as your city continues to grow and grow. In fact, today, New Yorkers are living longer than ever, and living longer than the average American for the first time since World War II. How did we do it? By encouraging wholesome eating, including banning trans fats in restaurants, requiring calorie counts on the menus of chain restaurants, and promoting low-salt foods. By reducing violent crime and taking a stand against illegal guns. By making our streets safer for vehicles and pedestrians and reducing traffic injuries. By expanding our park system and investing in programs that give people more options to exercise. And by reducing smoking, the biggest preventable cause of death on the planet. The bottom line is, with thoughtful long-term planning, we can prevent injuries, save lives, and create healthier cities.
Cities and towns which offer opportunities for people to enjoy and participate in cultural, sports and leisure activities go a long way to improving people's well-being.
Sports keeps you fit in body and mind. Sports bring people together, brings nations together, and it teaches us all valuable life skills. At the same time, sports keeps us healthy and prevents illness. But most importantly, sport is fun. Cities that offer sporting activities and facilities are healthy cities.
The second call to action tackles the conditions in which we live and work. Environmental problems affect our health. Addressing these is fundamental for healthy cities.
Improve urban living conditions.
More than 1 billion urban dwellers live in slums and shanty towns. They are at risk because they don't have access to clean water, proper toilets, healthy food, and good health services. These issues have to be addressed if we are to improve the health of city dwellers. We know that locating houses in safe places and improving housing conditions, controlling indoor and outdoor pollution, and ensuring safe water and improved sanitation all have positive impacts on health.
Dakar, la ville où j'ai grandi, n'a pas arrêté de s'agrandir depuis que j'y suis né. Comme la plupart des villes d'Afrique et de toute la planète, elle continue de s'agrandir tout le long du XXIe siècle. Des millions de citadins n'ont pas d'accès à l'eau propre ou aux toilettes et n'ont pas d'endroit où mettre leurs ordures. Il y a des villes partout en Afrique où les insectes comme les moustiques rendent la vie encore plus difficile. Éviter et soigner les maladies infectieuses comme le paludisme, c'est important pour chaque ville, c'est très important.
Women and children, especially if they are poor, are amongst those that have least access to good health services. Distressingly, women and children in poverty-affected areas are particularly vulnerable to illness, disease, and violence. In a modern world, it's hard to believe that women living in poverty risk their lives in the natural process of childbirth. Maternal mortality is one of the most overlooked human catastrophes in the world. Many women living in cities and towns do not have adequate antenatal care, maternal and newborn services, or access to reproductive health services. Our fight to improve maternal health and prevent child mortality will be increasingly fought in cities and towns. Apart from safe drinking water, no other health intervention has reduced diseases and mortality as safely and effectively as immunisation. Many children living in cities, including urban slums, are not vaccinated. It is the right of every child to grow up healthy and vaccinated against those diseases that can so easily be prevented. Women and children are already one of the most vulnerable groups in our societies, and increasing urbanisation puts them at even greater risk. We have to protect and support women because they deliver for their families, their communities, and their country.
So how can we plan better and improve living conditions? The third call to action reminds us that everyone must be involved in urban decision making.
We can all help run our cities.
Citizens often know best how to deal with local problems. That's why we must share information about planning for urban health, helping community groups thrive, educating citizens, encouraging public dialogue, and giving people a say in how their cities are governed can help maintain a spirit of community even in a crowded modern city. Let's involve local communities by creating opportunities for participation.
Majority of migrants move to urban setting. The most vulnerable, the undocumented, the displaced live in slum areas where living conditions are often poor. In time of economic decline, migrants are the first to lose jobs or find themselves in working conditions that are exploitative and expose migrants to vulnerability. Limited access to health services and social services are a critical factor. For this, we advocate for a more inclusive mechanism for health of migrants and their participation in the community debate and the community capacity to solve problems is critical.
But as we improve our cities, nobody must be left behind. Children, older people, and people with disabilities need cities in which they can live and thrive.
Make cities easy places to live for everyone.
We live in aging societies, and more than 1 in 10 of us is disabled. In cities that are accessible, everyone can be part of economic and social life. Practical steps include making public transport accessible to people with disabilities, developing safe walkways and good lighting, building public places and buildings for easy access, and promoting active city life and sports for all.
We need safe road crossings and buses which can take wheelchairs. That way, everyone can live in cities safely and with dignity.
Even the best of cities can be overwhelmed by extraordinary events. Natural disasters, armed conflict, and large disease outbreaks can devastate cities and put the lives of survivors at risk.
Protect our cities from disasters.
Disaster preparedness can save lives. We must locate hospitals in safe areas, strengthen health centres to withstand known dangers, prepare communities for emergency response, and improve disease surveillance.
En janvier, il a seulement fallu quelques secondes pour qu'un tremblement de terre détruisent Port-au-Prince, la capitale d'Haïti. Il y a eu des centaines de milliers de morts, de blessés et de personnes qui se sont retrouvées sans logement. Cette tragédie nous rappelle qu'à l'avenir, nous pouvons sauver des vies en construisant des villes qui résistent mieux aux catastrophes.
In a disaster, donated blood is essential for the treatment for injured people. However, even if the blood is at hand, we need to find a way to get it to the hospitals and health centers. In order to do this, we need a quality health service which can swing into actions when a disaster strikes. This will require resources as well as expertise. It will be a tragedy if someone survives the disaster, but yet they suffer or even die because they cannot get to the medicine, health services, and care they need.
Action now will not only help us improve the health and safety of today's urban dwellers, it will also form the legacy that we leave to the next generation.
What kind of city are you going to leave for us?
On this World Health Day, the World Health Organization is calling on a range of groups, ranging from city mayors, concerned citizens, the private sector, and civil society organizations to take action to address the health inequities and the health risks in the cities. It is doable. Sometimes it takes a long time, but if you look around the world, we have seen many successful, healthy cities. You can do it.